Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya, and here we take a stock of India's battle against COVID-19 pandemic. Now, recently the central government has deputed high-level teams to the states of Kerala, Karnataka, Rajasthan, Chhattisgarh and West Bengal in view of the recent surge in the number of new COVID-19 cases. The focus is on these 5 states now, where the numbers are steadily rising as far as new infections are concerned. And we'll try and understand in the next half an hour the reasons behind that, as well as what is being done on the ground to bring the situation in check, specifically in these 5 states. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Ms. K.K. Shailaja, teacher. She is the Minister of Health in the government of Kerala. We also have with us Ms. Urvashi Prasad, the Public Policy Specialist at Niti Aayog, and Dr. Suneela Garg, Director, Professor and Head of the Community Medicine at Maulana Azad Medical College in New Delhi. Welcome all of you to Rajya Sabha Television. And let me begin with you, Ms. Shailaja, since you are looking after the health portfolio in the state of Kerala, and we've seen how you've worked on the ground as well. But going by the present situation, where the numbers are rising, 2 things which we would like to know. 1, the reason behind the recent surge, and 2, what is being done by your government on the ground to go ahead and counter this surge?
Yes, as you said, we have a second wave in Kerala after the lifting of the lockdown. Actually, we expected this. We anticipated this thing, and we strengthened our health system to face this difficulty. And we prepared for that, and we opened more COVID special hospitals and COVID first line treatment centers and COVID second line treatment centers and COVID care centers. We definitely anticipated that once the lockdown was lifted at that time, the cases will increase in Kerala, because the number of expatriates is more in Kerala than other states, and we wait for that. The first part, as you said, we contained this thing or flattened the curve, and we succeeded in containing that thing up to March 24th. March 24th, the central government declared lockdown, and we got some breathing space to strengthen our health system capacity, and we yield very good result that when the lockdown was lifted at May 3rd, up to May 3rd, we have 499 cases, out of which only 3 died and all the others cured and discharged from the hospitals. And we flattened the curve to the 0 level.
Okay.
But after May 3rd, a slow increase in these cases occurred, and the graph was increasing at that time. But after the festival season, Onam season, the people, we issued some guidelines that no gathering should be there. Everyone should celebrate Onam in their home itself, and no gatherings, we are not allowing it. But anyway, some people gathered here and there, and we got some clusters after the Onam season. And also when the lockdown lifted, from the border, from the other states, people began to travel to Kerala, and also from abroad also, by air and water and rail and by road they came to Kerala. More than 9 lakh people returned here after May 3rd. And in the August and September, we faced some protest gathering of the opposition parties, and they gathered together. We gave warning that this gathering will make some problems, and that also made some problems here, and we got so many clusters here and there, and in some part it go to community. But because of our preparation, we are managing it. We are managing situation to contain this thing, and our ultimate aim is to reduce the mortality rate. Even in the peak, the curve become the peak, and even at that time, our mortality rate didn't go up to 1%. It is below 1%. Now it is during this peak, it is 0.34%. We are working for that.
But Ms. Shailaja, one point here, since you're mentioning, the mortality rate, and I agree with you that as far as mortality rate is concerned, Kerala has done fairly well there. But then if you look at the recovery rate, and specifically if you're looking at, these 5 states where the focus is right now, therein, Kerala doesn't seem to be doing that well. Any specific reason behind that? Because the recovery rate is somewhere around 70% for Kerala, whereas it is more than 80% for rest of the 4 states, Karnataka, Rajasthan, West Bengal, and Chhattisgarh as well.
Actually, Kerala did a scientific thing, Our aim is to slow down the peak. And we have the long drawn pandemic, we can say so. January 30th, we started the first case, and now it is going gradually increasing. But in Maharashtra and other states, I think it increased all of a sudden, and that is why the number of deaths were increased at that time. But our aim is to slow down the peak. Slowly it is increasing, and we can put our health system threshold properly and put this increasing of the peak under that health system capacity. That is why we can reduce the mortality rate. And it is increasing now, but in other states it's increased more. The scientists are saying that if 30% of the community got this infection, then the virus will slow down its peaking. And in Kerala, it is increased now. And that time also, we are keen in our observation to reduce the mortality rate and giving proper isolation and treatments, etc. Because of the delaying of the delayed peak, we can yield that result. That is scientific way.
Okay. Let me bring in the other panelists also here. Let me first bring Urvashi. Urvashi, what would you consider the reasons behind the surge in these 4-5 states which we are talking about today? And as Ms. Shailaja also mentioned, few aspects specifically to Kerala out there, the expat population, the festive season as well, and on the in the northern side of the country, the festive season is just about to begin.
Yes, that's right. In fact, this is a very critical time for all of India, I would say, really, because a few things are happening simultaneously. We are moving towards the winter months where we don't quite know how this will behave yet, because, of course, it's a new virus and a new entity. So, yes, we have some examples from Europe, etc. In Europe, you can see that as winter is coming back, again, the cases are on the rise, but we are a very different, population, demographic, all of that. So we don't quite know how it will behave in winter yet. The festival season, yes. Navratri, Diwali, we have all of that, that the northern states will also be facing. The wedding season as well in many parts of the country, you'll see a rise in the wedding season as well. And of course, there's continued opening up of the economy. Many sectors are now gradually opening up more and more. So the likelihood of people coming together, social gatherings, people getting together in markets, all of that has gone up. And I think that is, of course, a very important factor which is contributing to an increase in cases in many places, while the focus right now might have been on these few states. But of course, we'll have to keep a lookout for other states as well, be it Maharashtra, be it others. And I think this is where, while the health system needs to continue to, of course, focus on testing, continue to focus on bringing down the fatality rate, as the minister pointed out, in Kerala, they have done very well on minimizing the fatality rate. And that is very much the direction that, of course, all states would want to be taking. So I think while all of that needs to continue, the behavioral aspect is very important. And we really need to encourage people to, continue to follow the measures of, face covers, physical distancing, hand hygiene, because this battle really cannot be won, by the government intervention alone, as we know. We do need people to continue to adhere to these behaviors, especially in this very sort of tricky phase for us ahead.
Okay, definitely. It has to be all stakeholders on the same page, be it the governments, the state and the center, local administration, or the general public as well. And that brings me to Dr. Suneela Garg, who is heading the community medicine department there. Dr. Garg, from your perspective, does it all have to do with the change of season, or perhaps the festive season also around the corner, as both Urvashi and the health minister from Kerala is pointing out, or the behavioral aspect also remains very, very crucial here in terms of finding the reasons behind this surge in several states?
Yeah, that is one thing. Human behavior is something which is very, very crucial. Where we talk of masks, we talk of social distancing and sanitizing. But I think let me also be well aware, apprise you of the fact that the teams which have gone to the different states are comprising of not only joint secretary, public health expert, and also physicians. Now, physicians have gone to look at the standard treatment guidelines, and all of you must have heard of that solidarity trial, which just was declared by WHO, are drugs which are being used like hydroxychloroquine or remdesivir or lopinavir, like that, or interferon. Basically these drugs also have not proved to be very effective, what we were thinking to be. So that is where we need to again look at our treatment guidelines as well, apart from empowering our people, which is a key. You see, unless the human behavior changes, you can see in all the Delhis that which they show pictures of different markets and all, it looks like as if there has been no difference kind of. So apart from which is a very, very tough job for the states to change and address the human behavior, but we need to look at from a very holistic angle. That means we need to look at infection control, we need to look at treatment guidelines, we have to upgrade our providers as well as to what are the newer treatment guidelines and all that. So these are some of the important critical issues which we need to look at from the public health perspective. And every day we need to keep a watch that our testing doesn't go down. What is our recovery rate? You see, basically when Shailaja ji pointed out, that our mortality rate in Kerala is about 0.34%. But at the same time, if you look at the infection positivity is about 15.27% approximately. So we need to look at that part also. And you see, and this is now today it is in Kerala, because Kerala is one of the best states which I always acknowledge, because this had a big fight against Nipah virus. So they had, all the systems in place to look at all this. So that's where we need to look at the state which has got already systems in place and have addressed these issues. So this we have to very carefully watch these issues with regard to all the states as to what is the infectivity, what is the recovery rate, what is the death rate, and all that. So that is where we need to watch. As Urvashi also pointed out, it's not only now these 5 states, but we need to be cautious about whole of country.
Okay, definitely. With the festive season around the corner, all of us will have to be cautious. But as you pointed out, Dr. Garg, that it's not only about the preventive measures, but also the treatment protocol or the treatment guidelines there as well. That brings me back to Ms. Shailaja there. From that perspective, Ms. Shailaja, in your state, is that a cause of concern in terms of the changing protocols for treatment guidelines? Because this is a dynamic situation. We're learning new things about this particular virus almost on a daily basis, and hence our responses to this particular crisis, the pandemic, are also very dynamic in nature. So are we, in your state, are you able to go ahead and make those dynamic changes equally to the treatment protocol or the guidelines there as well?
Yes, that is a difficult thing, but we have to do that, because these guidelines should have to change every time, because as you all said, this is a novel virus, and some confusing statements are coming from all places, and we are eagerly watching for the knowledge from outside. And sometimes scientists said that the plasma treatment is very effective, and the other time they are saying that plasma is not effective, don't give plasma. And other time they are saying that remdesivir is very effective to this, and we start remdesivir here also. Now they are saying that WHO also is saying that remdesivir is not effective, and the same thing about the other drugs also. And at that time, what we can do at that time? Actually, we cannot change these things all of a sudden. We are now also we are giving plasma because in our experience, plasma treatment is very. I think some more number of people are recovered through the plasma applying plasma therapy, and that is our experience here. We cannot change it all of a sudden, but we have to take this knowledge from WHO and in India ICMR and other guidelines. We have to follow that, and we have to follow something from our experience also. That is the difficult thing, but we have to follow it because this behavior of this virus is peculiar, and the symptoms also sometimes are changing, and the how it affects the internal parts of our body, that also is changing. Sometimes lungs are in critical stage, and the other times it is affecting the heart also. And we should have to frame or mold something from our experience also. Kerala is doing that things in here. Our medical board is discussing everything, and we have an expert committee here, and we are discussing with the expert committee also, and we are setting our protocols and these SOPs in proper time in a proper manner.
Okay. One more thing, Ms. Shailaja, in your first response, you spoke about the reasons behind the recent surge, and you said the expat community, and obviously, the festive season after Onam celebrations, it was seen that the numbers are rising. So that clearly points out to the fact that the behavioral change which everybody is pointing to, Urvashi also said, Dr. Garg also pointed out, you also mentioned, but is it, becoming difficult, or is it how difficult it is for authorities to go ahead and, bring that behavioral change, or rather push people to bring that behavioral change in themselves as far as preventive measures are concerned? Is it difficult on the ground for the authorities, for your teams, your government to try and implement that, or are people aware of it?
Yes, from the beginning itself, we are trying to do that. This is a behavioral disease, and the behavior change is more important than other time. But from the beginning itself, we started the campaign Break the Chain. The only way to get out of this virus is to break the chain of the transmission. And we have a very good campaign on that. And with the help of the local self-government and some NGOs and other organizations, we start that campaign, that to wear mask and also to use sanitizer, and to keep a 2-meter distance from each other, social distance. And we have 3 stages of this campaign. First stage, we campaign this thing as Break the Chain, and second stage we use the acronym that SMS. S for soap or sanitizer, M for mask, and that last S for social distance. And the last time also we have some new ideas, and we are propagating these things, that our health is our responsibility, and we have this Break the Chain is according to it is for our protection, and we have to protect our lives more than anything, and it is our responsibility. We are propagating like that. I think more than 80% of the people are obeying these things. They are wearing in Kerala, 85 to 90% of people are wearing masks when they are outside. But there are some elements there, 15%, that is much, and they are not wearing mask, and they are responsible for the spreading, we can say so. And some people are not allowing. Some people are jumping quarantine and coming to the society when they are positive, and we are trying hard to put them inside, or maintaining proper quarantine. And now also we are trying it through the help of police and local self-government. We are trying hard to change the behavior of people for this. But 8 months have gone, and the people are feeling some fatigue or something to stay inside the home. We applied the Grand Care program also, the reverse quarantine. And the old age people are staying inside their home, but they feel tired. They are feeling tired inside the home, and they want to come outside. But now we are insisting them to keep inside. That's a difficult thing, And that is why in some festival season, some are coming outside and getting this virus.
Okay. So it does become a very, very important aspect there as far as behavioral change is concerned. But Urvashi, I'd like to bring you back to the treatment protocol aspect there and the rapid dynamics involved in that particular situation. Given the fact that, as we were saying earlier, this particular virus is pretty dynamic in nature, and also the fact that we also tend to get to know a lot of new things every day about how the virus behaves, and that also changes our response mechanism in terms of the treatment protocol. So, as the minister was pointing out, do you agree that it becomes difficult for the public health system to respond that dynamically to the situation as well?
Yes, I think definitely, and I think Kerala, I think as Dr. Garg also pointed out, is one of the much more advanced public health systems, and even in terms of general sort of awareness levels, etc. It might be actually relatively on the higher side if we compare to a lot of the other states. So yes, it is a challenge. I think the states which are starting off with a stronger base can obviously adapt more quickly or adjust more quickly to these sort of rapidly evolving situations in a pandemic, whereas for other states, it might be harder. So I think that is there, but that's the nature of this disease and what we are facing. The international guidelines also keep revising. If we just look at the WHO, the sort of what they've been saying for all these months, it's naturally kept changing based on evidence that keeps emerging. So I think that's a little bit a part of this. But yes, it is true that, of course, we do try to make sure that we have sort of guidelines in place which are as comprehensive for the current, times as possible. But as the minister said, that a lot of it also at this time, does evolve based on the experiences, what experiences in a particular state or in a particular district. And I think that's what I would like to say, that, even on the awareness side, what we're trying to do now is sort of really customize our strategy to the district level, because what might be working, in one place might not work elsewhere. So we're trying to learn from different states and different good practices. The campaign in Kerala, for instance, various states have implemented various good initiatives. So we're trying to learn from those and sort of also replicate those, but make sure that the local context is, very much upheld, because that's really what makes the difference in something like this.
Okay, definitely. The local context does, may make a very important element out there and should influence the way situations are tackled in respective areas. Dr. Suneela, Garg, concluding comments from you in terms of what more needs to be done. Behavioral change, one aspect, responding, to the dynamic situation, the evolving situation in an equally dynamic manner is another one. What more than that can the state governments or the central government or the local administration need to do to try and contain this surge, and at this crucial juncture as well, that is we are at the cusp of festive season and the winter season also about to begin?
I think we need to strengthen our systems, which is there in the government sector, private sector, standalone practitioners. That is one side of it. The second part of it is that policy. We have to keep in tune with our policy guidelines, what is there. The third part is our major important stakeholder, that is the common man. So you see, when whatever said and done, you see, in my little experience of last 4 decades, in public health, what I have seen is that, we say smoking is injurious to health. It is written on the packs, or we say alcohol is injurious to health, but we see a lot of cases. We have an example of HIV in front of us. We had all the types of behaviors which could have been prevented. But IV drug abusers and all that, still, we had to ultimately come to terms with the behavior and start with needle exchange projects. So that is where I feel it is the systems approach, where we talk of 6 pillars of system strengthening. We talk of involvement of a common man, and we must keep our private practitioners and government providers really updated. That is one thing which is very, very important, and we must be tuned with the latest, and whether it is NCDC guidelines or it is WHO guidelines or ICMR guidelines, we have to keep abreast and we have to keep following that. This message should go right from our, I say to the medical students, to the topmost policy makers and providers, because ultimately it is everyone is going to make a difference. As has been pointed out, it's a new virus. And it's we have dealt with viruses earlier also, like MERS or and all that. That's where we have the experience. But then gradually over a period of time we have to follow a holistic approach.
Okay, so there it is. It is all about following a holistic approach in response to the COVID-19 pandemic. Thank you so much, Ms. Shailaja, as well as Urvashi and Dr. Suneela Garg, for sharing your views on this aspect of how to deal with the surge in these 5 particular states, recent surge in the cases of COVID-19. Once again, before we leave, we would like to remind you of the COVID-appropriate behavior, which is the best defense against COVID-19 pandemic right now. That is, wear a face mask, wash your hands properly, and ensure physical distancing of 6 feet. These are 3 simple steps which you can take to protect yourself and your loved ones as well. That's all we have. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television.